You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, dental implants, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic, Dr. Mehdizadeh. Dr. Mehdizadeh, welcome to the program.
Thank you for having me, Randy.
Now, for people that don't know your practice, who's your typical patient? What are the different services you offer?
Well, we don't really have a typical patient. We see people from all walks of life, and we can provide a wide gamut of services. We provide a full complement of implant and cosmetic dentistry. So, for example, we can do something as little as whitening. We can brighten your smile.
Is that popular right now?
It is. It's very popular, and it's a very small procedure. And just whitening your teeth a couple shades can take years off your smile. We can fix chips. We can close little gaps with 1 or 2 veneers just to make your smile a little bit better, or we can take years off your smile by doing a full mouth of veneers. If you're missing a tooth, for example, we can replace it with a single implant all the way up to placing an entire arch of teeth on 4 or more implants. And for our implant patients, we have different categories of patients. There are people who have their teeth, but they're headed towards a denture and they want to avoid it at all costs. Or we have people that have been in dentures for a while and they're not fully accustomed to them and they don't like them because they're loose, they just hate them, it doesn't allow them to eat, they can't have an active lifestyle. And then there's a whole group of patients who've had dentures for 10, 20 plus years and they've just become adapted to them. So to them, it's the normal and they don't know what alternatives there are out there, so they've never really explored the alternatives or the possibilities.
Now, we said at the top of the show, no more dentures. You think that's
correct.
the future of dentistry? That means traditional dentures will be out? They'll all be attached to something?
I think so. At least that's the future we're pushing for in our practice. You know, if you're wearing a denture, you can't really have an active lifestyle.
What do you mean?
Well, the dentures can be loose, especially your lower one. It moves around when you speak. You have to use adhesives. A lot of people hate them. That's why it's a billion-dollar industry, because so many people use them. You can't play tennis, you can't surf, you can't swim because you're fearful that they might come out or become loose. You can't eat what you want. If you're going to a restaurant, you're looking at the menu and maybe there's only 1 or 2 things that you can eat on that menu.
Is that what the patients tell you?
Really, that's the life of a denture wearer. So you'll be out at a restaurant and you don't want to embarrass yourself in front of your friends. So you're only picking what's soft, or you're expending mental energy thinking what you can do to avoid embarrassment. So you're not even out there enjoying the meal. All you're trying to do is save face.
Okay, now San Diego is a healthy place. Are there really that many people out here that have false teeth?
Well,
or upper lower denture, or headed dentures?
Yes, so depending on what survey you look at, there's about 35 to 40 million Americans in dentures. So in San Diego, that's about 400,000 people. If you think about it, that's filling Qualcomm Stadium 5 times over. That's a lot of people.
Okay.
And we're only counting of people that have dentures. This isn't even people who are headed towards dentures.
Okay.
It's a lot of people.
So you have a system where you do it all right there in your office. You do
That's
all
correct.
the parts.
Yes.
So I guess how it's normally done, correct me if I'm wrong, that you go to one, like an oral surgeon, periodontist that does the surgical part.
Correct.
And then somebody else that puts the teeth on top.
Correct.
You're trained in both.
Correct.
And you have the imaging center right there?
Yes.
Okay.
So the advantage to doing this is when we are planning the procedure, what we want to do is have a vision of what it is from bottom up, which is the placement of the teeth, what the engineering of it is going to be, the implants that anchor into place, and then also the cosmetics and the function of it. So at the end, you look good, you can speak well, you can chew well. It's funny, some people come in and they just want to eat or be out of pain. Some people come in and they just want to look good. So people come in with different goals. We have the training and the ability to deliver both. So
because you're a cosmetic dentist, right?
Yes.
Also?
Yes.
Here in San Diego?
Yes. One of our focuses.
I know 2 people that went to you.
One of our focuses is restoring people's smiles, making them look younger, making it look natural, making it look beautiful. The funny thing is that the people who come in and they want to get out of pain, or they just want to be able to chew, they don't want to worry about their teeth moving. Once we're done with the treatment, something clicks in them. They were never really worried or concerned about the cosmetics, but now that the teeth look fantastic, all of a sudden they start getting compliments, or they notice that they're smiling more, or they're just more magnetic to people. And so all of a sudden the smile and the cosmetics of it becomes really important to them. And then there's another group of people who are really just concerned with how it looks. Maybe they're trying to get ready for an event like a wedding or a reunion and they just want to look good. They're not happy with the appearance of their teeth. They don't even care about chewing or the function or anything like that. But once we're done with the treatment and they had loose teeth before, they had flared teeth, they had spacing, now they can bite into fruit, crunch into a salad, a whole new world opens up to them. So everything looks good, but now they're secure with their teeth, they can eat whatever they want. It's just a whole new world.
Now you're a dentist, so it doesn't surprise me to think that you feel that the smile is like one of the most important things.
It's not just me. You don't have to take my word for it. It really is important. So, I mean, you can look at People Magazine, Cosmo, USA Today, any of these publications. In any survey that they ever do regarding, for example, what makes the opposite sex most attractive to you, the smile is either number one or top three, without fail.
Yeah,
It is one of the most important aspects of your personality, of your charisma, of how you look. And nobody can argue with that. It's really that important.
Now, okay, so you say there's maybe 400,000 people in San Diego that are wearing dentures.
Correct.
A lot more than that that are headed to dentures. If dental implants are so good, why aren't they all doing it? Like, what's your take?
Well, first of all, a lot of them are doing it. They come into my office, and when we're done, without fail, to the last patient, they always say, "I wish I'd done this sooner."
Okay.
All of them, without fail. Now, the people that aren't coming in, it's because they're not, the people who are wearing dentures, they're not in the dental system. If you're wearing a denture, you don't go to the dentist anymore. Sometimes you might go because there's a sore spot or they're loose and you get a reline, but it's just generally not a good experience. You want it over with and you're out of the system again. Also,
so they don't know their options because they don't go.
Well, they don't know their options because they don't go and nobody explains it to them.
Okay.
Another is, let me tell you about the life of a denture wearer before they got into dentures. They didn't get there overnight. It was a long process. It was getting lots of crowns, getting the crowns redone. It was root canals that failed, gum disease, bad breath, pain, all sorts of problems. It's this long process. It was lots of dental visits, never-ending cost. And so a lot of these people, when you take their teeth out, they're actually relieved because now there's no more expense, there's no more pain, it's over. The last thing a denture patient wants to see is me.
Now, do you hear that? I mean, patients will still say, "Hey, no offense, but I hate the dentist."
Absolutely. They'll come in and they'll say, "Hey, you're a great guy, but I hate being here. I don't like to be at the dentist." And I completely understand because given their experiences in the past, I understand. Another reason why they're not coming in is because they look in the mirror, they count the number of teeth they have, and they think they need an implant for every single one of their teeth. That's not true.
How many do they need?
So you can do as minimum as 4 implants. We can place 4 implants and put a full set of teeth on top, solid teeth that you can eat with. Sometimes I like to put in 2 extra implants. It doesn't cost you extra, but it's just extra engineering so that you can eat whatever you want and it's strong. Another reason why people don't come in is they self-diagnose. Sometimes they think they're too old, which is really not true.
How old can you be?
Well, we just started somebody that's 84 years old. He's a retired pilot, and as soon as he's done, he wants to travel the world again. So it's really not an age issue.
Now, why would an 84-year-old want to do this?
Because they want to eat whatever they want, and they want to be able to smile just like you and I, because they still have self-esteem, and that doesn't change with age. It's really a health issue. If you're older, chances are you're not working. So life actually revolves more around food. You go out with your friends and you go out to eat, or people visit you and they bring food. It's social. And if you're not eating or you're not able to eat, then things aren't good. Not only that, even if you are eating, you're not enjoying the foods that you're eating. Again, you're not biting into fruit, you're not crunching into a salad. So just the whole experience itself is not pleasant to begin with.
So age has nothing to do with getting dental implants?
No, and that's one of the reasons why people don't come in, because they think they're too old, and that's not true. You can be any age. It's really a health issue. If you're healthy, we can take care of you.
Yeah, but what if you have bad gums? Like you have the, bad gum disease?
Well, a lot of people self-diagnose like that as well. If you have bad gum disease, that's a bacterial process. It's a bacterial infection, and the source of that is the teeth. So if we remove the teeth, we can actually remove the infection systemically. Your whole body becomes more healthy, but also the gums and the bone become healthy to the point where we can place implants, place a full arch of solid teeth on there, and now you have healthy teeth going forward for the rest of your life. It's actually better than what you had before.
How soon could you eat?
They can eat that night. In the beginning, we want you to be on soft foods just so you can become accustomed to it, but you can eat whatever you want. I had one woman, on her first follow-up appointment, when she came in, she was absolutely delighted, and I couldn't tell what it was about. So I asked her, and she said that she can't stop eating peanut M&Ms. Now, I don't know why this has stayed with me, because I love peanut M&Ms myself, and just the texture or that crunch, she just can't get enough of it. So she just keeps eating peanut M&Ms. And it's little things like that, just that quality of life improvement, where now she's secure enough where she can really eat whatever she wants, and something as insignificant as a peanut M&M is something that she'd been deprived of for years.
So you can eat, let's say like raw broccoli or a carrot with your front teeth?
You can eat whatever you want.
Even with the front teeth, you can bite into
Yes, you can bite into whatever you want. I tell my patients, from now on, move forward and live your life normally. You can eat whatever you want. And then they come back to me and they ask, can I eat ribs? Can I eat nuts? Can I bite into an apple? Absolutely. You can eat all of these things. They're just like your natural teeth. And that's the whole point of doing this, so that we can restore you to the person that you were, so that you can move on with your life and live an active, happy, healthy lifestyle without ever having to worry about your teeth.
Now, you're big on IV sedation.
Yes, we are one of a handful of general dental practices that are equipped to provide full IV sedation in our facility. It's fantastic for the patients. You come in, we run the IV line, the next thing you remember is you're at home. What's also wonderful about that is it lets me go in there and do the procedure faster, and so we're in and out. There's less chances of complications, and also through the IV line, we give you steroids. Now, what's wonderful about this is that you don't get swelling. The steroids prevent swelling, and just because of that reason, there's minimal discomfort. There is very little, if any, pain involved at all. So it's just a night and day difference as far as what the patient experiences.
What if you have a little bit of osteoporosis? Can you still do this?
If you're 84, chances are you have a touch of osteoporosis. That's across the board. Or you might have hypertension or diabetes. We can work with that. We coordinate with your primary care physician so that we can do this as safely as possible for you. And for example, with osteoporosis, if there's not enough bone there, we can build bone. It might take a little longer, it might be a little bit more complicated, but that we're up for the challenge, and it shouldn't deter you from getting the teeth that you want. It shouldn't deter you from having an active lifestyle or being able to eat whatever you want or having the smile that you want.
I know a couple of denture wearers. They never complain. Are you saying there's no such thing as a happy denture wearer?
Well, they don't complain to you. If you think about it, a denture is not something that people publicize. It's usually a point of embarrassment, and so a lot of people are actually very good at hiding it, but they do complain to me. So let me tell you about the life of a denture wearer. If you're at a restaurant, like we said before, you can't order everything off the menu. If you are dating, for example, it's a secret. Going right out the gate, you're not going to let people know that you have a denture. It's something that you have to hide. If you have a spouse, then you're timing your day around the schedule of your spouse, so when they leave, you can take the denture out and clean it, because nobody wants their spouse to see them with a denture.
Okay.
You know, I had a patient who didn't want her husband to see her without her denture, so she actually slept in them. But the problem is that they were uncomfortable. So during the day, she's anxious because she can't take them out. She doesn't want him to see her without teeth. And then at night, she's wearing them, and she was telling me it keeps her up because she can't sleep.
All right.
So, I mean, that's a terrible place to be. So we're in San Diego. If you're in a denture, you forget it. You're not surfing. You're not playing golf at Torrey Pines. You can't really have an active lifestyle because it takes just so much energy being worried about your
denture falling out.
Your denture falling out, your teeth being loose, you're embarrassing yourself in front of your friends. So it makes people withdraw. You don't really fully engage in life's activities, and I think that's unfortunate.
Now, one of the things you say is that on the day of the procedure, you can walk in without teeth and walk out with fixed teeth, full arch, upper and lower, that don't come in and out.
Is
that right?
That's absolutely true. And what's wonderful about that day is that when people first look into the mirror or they tap their teeth together and they get that nice click, something clicks inside them, something changes. Their charisma uplifts. You can see what a big transformation it is, because they notice some people smile, some people laugh, some people cry. They all respond a little bit differently. But
so when you show them the mirror for the first time, do they get emotional?
Incredibly emotional. And people show different emotions, but it's all a variation of they're looking in the mirror and they're realizing within themselves that this is the first day of the rest of their life, their new life. Okay. It's really that transformative.
Good. Going into this interview, I always think it's just teeth, but I guess we take it for granted because we have our teeth.
We really do. I mean, if you think about it, it's such a part of your charisma. So if you walk into a party or into a social gathering, who are you going to think is more inviting? It's going to be the person that's laughing and smiling and talking to people. It's not the person that has the pout in the corner. Or let's say you're at a job interview. All things being equal, who are you going to hire? It's going to be the person who's self-assured, self-confident, possibly attractive, the person who seems more well-adjusted.
Well, if one is smiling and one isn't, it's definitely
really
the one with the enthusiasm is a big deal.
It really makes all the difference. It's such an important part of our self or our personality, and we really do take it for granted. But as soon as you lose it and you become self-conscious about it, you can see what a big effect it has for your life.
Because you're a dentist, I mean, when you're out and about, can you spot people that are hiding their smile? Or they're ashamed of their smile?
Yes, you notice it. And normally people would think, okay, this person is unfriendly, they're antisocial, or maybe they're in a bad mood, they're tired. It could be a whole number of things. But really, it could be just that they're embarrassed by their smile, or they just don't like their teeth. People like that actually get prejudged a lot.
What do you mean?
Well, for example, if you have really bad teeth, people immediately prejudge you that you might be less educated, or you don't have as much money.
Good point.
Or you're not successful. So you can be discriminated against in very subtle ways that you're not even aware of, but people definitely judge you. It's such a big part of your personality.
You know, in the movies, and my son and I were talking about that, in the movies, if they want to make somebody look like a criminal or a bad guy, they make their teeth gray.
That's absolutely true. Or they give them a missing tooth to make them look unintelligent. So, you know, again, we do take it for granted, but it is such an important part of our overall personality, this fundamental part of our appearance. And it's not just an outward appearance, it's the confidence that it gives you within yourself. If you know your teeth are secure, if you're taking them for granted and you can go and chew whatever you want and you're not giving them a second thought, that gives you a completely different type of confidence.
Now these people, okay, so they have no teeth, now they have teeth that don't come in and out. And I think we joked about it. It's like the hair club for men. You know, these people are hiking and running, and is that the way it is? I mean, it's like a
really
pivot
true.
point in their life in a way.
It really is true. You know, in life, the less you do, the less you do. So if you are embarrassed about going out with your friends to a restaurant, or you can't go play tennis, or you can't go back to surfing or pick up surfing, or maybe even go skydiving, any of these activities that are active. If you're withdrawing from these things, well, you're really missing out. So, or dating, kissing, things like that.
Okay.
So if you are able to engage in these things without having to worry about your teeth, it really makes a massive difference in your life.
Okay, so let's, like on a consult. Okay, so a patient comes in, they're wearing a denture, or maybe they're in a position where you can't save their teeth and all their teeth have to come out. What are their options when it comes to dental implants on the consult?
So you have multiple options. At bare minimum, we can place 2 implants on the lower jaw where we can attach a full arch of teeth and it snaps in and snaps out.
Could they eat with that?
They can eat with that. It's not ideal, but it is leaps and bounds better than a denture that just moves around in your mouth like a hockey puck whenever you talk.
All right.
Right? And so that's one option. The next step up is to put a bar or possibly 2 upper implants where we can attach a whole arch of upper teeth. So then at least the upper and lower teeth are secure. So they might move a little bit in your mouth. You can still eat. You might not be able to chew as ideally, but what is great about it is at least in your mind, you have the peace of knowing that they're secure. So you're not gonna start laughing out loud and they come out, or you're not gonna sneeze, so at least you have security. And then what we really ideally try to do is create fixed teeth. We want you to have a full set of upper teeth, full set of lower teeth that are solid. So you can—
That don't come out.
That don't come out. So they're basically an afterthought to you. So you can eat whatever you want. You can laugh at a joke whenever you want.
Are they permanent? Are they permanent?
They're permanent. They don't come out. That's absolutely—
Sorry for interrupting. Okay,
Sure.
so you could laugh, you could eat whatever you want.
Yeah, you can live your life normally. That's the whole point of it. You want to go back to being the person that you were before you had all these dental
You
problems.
just brush them and what's the maintenance?
So just like regular teeth, you just brush them. Every 6 months you come to the dentist and we clean you up and we maintain you. Another thing that I want to mention is the roof of the mouth. If you're wearing a denture, the roof of the mouth is covered. So when you first got the dentures, that first week was terrible and then you got adapted to it. So for a lot of people, it's their normal and they don't know any different, but it's bulky. Sometimes it makes people gag, and you really, even if you are eating good food, you're not tasting the food that you're eating because it covers the roof of your mouth. Okay. So one of the real great advantages of having fixed teeth is that the roof of the mouth, that extra plastic, is completely gone. So you get an arch of fixed teeth, just like your natural teeth. And so when you're eating, the textures of the food, the taste, the smell, all of that, it goes back to the way it should be.
Now we're short on time, and I have to ask you this question because it's about the money. This can be expensive. Medical insurance, or dental insurance, I should say, does not cover the entire amount. Medicare, Medicaid definitely doesn't cover
But we can
this
talk
procedure.
about financing. So we can create budgets that people can live with. There are financing options.
So people are financing this.
Yeah, there are financing options that are comfortable that people can live with. We can even phase treatment where we do some of it now and then do some of it later. And at the end, we put it all together and the end result's really the same.
Okay, good. So you love dental implants.
I absolutely love them because they're truly transformative. We can take somebody who was self-conscious about themselves, who was withdrawing from a lot of life's activities. They're not even aware that they're withdrawing, but we can take somebody like that and give them a completely new personality, a whole new lease on life, give them a completely new charisma, beautiful smile, natural teeth that look fantastic.
In one day.
In one day, and a bite that lets you eat whatever you want. Let me tell you a story.
All right.
So this is about a month ago, I was at Piatti and I'm waiting for a table and one of my patients comes up to me with her husband and she tells me, and this is an exact quote, she said she's obsessed with her teeth. She can't stop smiling. And what was really fantastic, the husband thanked me, and I hadn't met him throughout this process. The husband thanked me and he said, we gave her confidence back and now she's finally herself again. So imagine how many years it's been that he thought she's not herself, and finally we gave his wife back to him, basically. So I have another patient, she's 55, she's a librarian, and she was in upper and lower dentures. That's way too young to be in dentures. Nobody at that age should be wearing dentures. And she was a very outdoorsy type, and during our consult, she told us that she loves nature photography. That's one of the things that I found out about her. She loves to go out on hikes, photograph nature. Okay. What we did with her, we could have given her a snap in and snap out, but instead we gave her a full arch of solid teeth, full arch of lower teeth, and it's just completely changed her life. And now whenever she comes in every 6 months, instead of showing us nature photography, they're all selfies. We're in the age of the selfie now. So that's how much she loves the way she looks. It just completely changed her personality.
So, and we are short on time. Okay, so IV sedation. So I guess there's, the fear of pain. That's not an excuse. You have financing available. And people need to know, it's a real interview. I'm not trying to endorse you. I'm just asking the questions. But, this is one of those things that, as you say, is life-changing. You take somebody that can't eat and chew, and now they can eat and chew. Or somebody that can't laugh at a joke, and now they can laugh at a joke.
Absolutely. Wayne Gretzky said, you miss 100% of the shots you don't take. So I would say, if you have dentures that are uncomfortable or loose, or if you have teeth that cannot be saved and you're heading towards dentures, you owe it to yourself to find out what your options are. You shouldn't have to be in something that prevents you from engaging in life. I think everybody should be able to laugh at a joke, eat whatever they want, and smile when they feel like it. So you really owe it to yourself to be able to do something that allows you to engage in life fully with vigor.
Yeah, but what about those people, and I had to ask you this, if you've been wearing dentures for like 25 years, can you still do this, or you don't have enough bone?
We hear stories like this all the time where the person thinks they don't have enough bone because they've been wearing a denture so long. And if you've been at another office where they tell you don't have enough bone, that might be true with the treatment approach that specific practice is trying to take.
Based on their training?
Based on their training, based on their imaging, based on what their treatment approach is. But with advances that we have now in three-dimensional imaging, tilted implants, guided surgery, what we can do is take advantage of the bone that's already there. Nobody has no bone. What we find the bone that's there, and we can place implants in there and anchor a full arch of solid teeth to them. Worst case scenario, if you do need bone, we can build it. Again, it might take a little bit more time. It might be a little bit more complicated, but that's what we do. Okay. And we can get you where you need to be.
Now, I've been to your website. So it's like you say that you plan surgeries, you do them on a computer oftentimes first. What does that mean?
This is one of my favorite parts. So when we go to the day of surgery, the cosmetics and the function of it aren't a mystery to me anymore because we do a lot of planning beforehand. So with our three-dimensional imaging and our diagnostics, what we can do is we place the implants virtually. We basically walk through the whole procedure virtually, so it's been done before. So when you come in on surgery day, there's no mystery to me. We've done this before and we're ready to go.
I think we should mention, I think it's surprising that it seems like a painful procedure, but you say that the patients, it's not something they really complain about a lot.
Not at all. With IV sedation, the experience itself is pretty fantastic. And then afterwards, people tell us it's really not what I thought it would be. It was much easier than I expected. And that's across the board. Everybody says that. So if you're apprehensive about it, you really shouldn't hold yourself back from getting the teeth that you need and want.
Now, you say a lot of people either hang on to their teeth too long, right? Or the denture wearers, they're miserable about their teeth like maybe 10 years before they finally get to you.
That's true.
So what do you say to those people that are watching this?
What's unfortunate about that, I think, is that they're missing out on good years. As I told you before, without fail, down to the last person, when they're done, people always say, I wish I'd done this earlier. So it's really unfortunate when people hold on to it too long, because you're not really doing yourself any favors. And if you really don't like something about yourself, you should change it. You shouldn't be losing good years for no reason or because of an unfounded fear.
And teeth are one of those things I guess you could take care of.
Absolutely. I think it's such an important transformative part of your life, and it can really change the way you engage with other people. It can change your dating. It can change your diet and your health. It can change your self-confidence and your charisma. I had this one lady, and this is something I never even thought about. Once we gave her new teeth, they're white, perfect, beautiful teeth. And she said an entire new world of bright lipsticks opened up to her. And it never even occurred to me that you can't really be wearing bright lipstick if your teeth aren't fabulous and white.
Good point. Okay, we're out of time. Final message, somebody watching this, and for whatever reason they're still afraid, right? Maybe they've been told all their teeth have to go and dentures are their only option, or they're already wearing false teeth and they think that they're fine, like as you say, they're just, they've adapted, but they're still skeptical about dental implants. What do you say to them?
What I would suggest is you owe it to yourself to see what your options are, so that you can make an educated decision as to what you want to do with yourself and with your future. So I would invite you to come into our practice and have a chat with us. We love what we do. We love sharing what we do with other people, and come and see what we can do for you.
Consultation is free?
Absolutely. We love to talk. I love to share what I do with people. I'm here to chat with you.
Okay, good. I want to thank you for coming on the show. Great stuff.
Thank you.
And they could go to their website, your website, make an appointment. They get to see you?
Absolutely. The consultations are with me.
Okay, good. Thanks again for coming on the program.
It was a pleasure.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.